Thanks so much, Kat. Hello, and thank you all for attending today. My name is Nicole Jarvis, and I'm the Senior Manager of Programs at Cancer and Careers, and I'll be your host for today's webinar. Before we begin, a few housekeeping items related to accreditation, and for those of you who don't require this information, please bear with us. I promise to be as fast as possible. Today's webinar is accredited for CEUs by NASW, New York State Education Department State Board for Social Work, and the California Board of Registered Nursing. If you plan on receiving continuing education credit for this program from any of these accrediting bodies, please proceed with the following steps. First, you must call in individually. Participants who listen in on someone else's line will not receive credit. Second, you must complete and submit the evaluation and post-test, as well as receive a passing grade on the post-test. Following today's session, you'll receive an email with all of this information. The follow-up email will be sent by 5 p.m. Eastern Time on Thursday, January 11th, and certificates will be emailed within 4 to 6 weeks. Also, please note that the planners and presenters for this program have not disclosed any pertinent financial relationships or conflicts of interest, and that no commercial support was provided for this program. Thanks in part to a generous grant from Genentech, Cancer and Careers has created the Balancing Work and Cancer webinar series to provide patients, survivors, and healthcare providers with concise, targeted information to help you understand a variety of issues that surround balancing work and cancer. We all know that cancer is expensive, but there are steps you can take to improve your financial health after a cancer diagnosis or treatment and to alleviate some of the associated stress. Today's presentation will discuss how to rebuild your credit, deal with medical bills, and explore financial assistance options. Presenting for us today is Monica Bryant. Monica is a cancer rights attorney and COO of Triage Cancer, which helps survivors, caregivers, and healthcare professionals navigate cancer survivorship issues. But most importantly for us, she's a longtime collaborator and is extremely skilled at taking complex legal, financial, and insurance issues and making them easier for us all to understand. Following Monica's presentation, there will be time for you to ask questions, so now I'll turn it over to Monica. Monica?
Thanks so much, Nicole. I am delighted to be here. So just before we get started in the meat of the topic today, I want to tell you a little bit about my organization, Triage Cancer. We are a national nonprofit organization that provides education and resources on the entire continuum of cancer survivorship issues to survivors, caregivers, and healthcare professionals. And we do this in several different ways. We host a speakers bureau of experts and survivors available to anyone hosting an event. And we also host an educational blog, provide online resources, and participate in seminars and webinars like this all over the country. We are delighted to be such a great partner with Cancer and Careers and to be here today. And I wanted to tell you a little bit about Triage Cancer because there are some places in the presentation where I will point you to our website as well as to Cancer and Careers website for additional information. So the key topics for today are going to be about rebuilding credit, dealing with medical bills, and then accessing additional monies through disability insurance or financial assistance options. Now, in 2013, a term was created or coined called financial toxicity, and it is certainly not, well, it's a relatively new term, it's certainly not a new problem. The out-of-pocket expenses and financial impact that a cancer diagnosis can have on somebody and their loved ones are immense. But there are certainly some things that, as Nicole mentioned, that can be done to mitigate that impact. So what actually contributes to these feelings of financial instability after a cancer diagnosis? We certainly know that having health insurance can make a huge difference in somebody's financial health, but even those with health insurance policies may find out after a diagnosis that their policies don't cover as much as they thought they would. And prior to the Affordable Care Act, otherwise known as Obamacare or the ACA, things were certainly more challenging. But even having access to better quality health insurance doesn't completely solve the financial problems because we certainly know that medical bills can still be overwhelming. There may also be changes to your employment status during and after cancer treatment. Perhaps you had to take time off or leave your job entirely to get through treatment and recovery. Maybe you've gone from full-time to part-time And you're probably feeling that change in your wallet as well. And even if you've had some sort of disability insurance, which we will talk about, it can be next to impossible just to pay your monthly expenses, let alone keep up with all those additional medical costs. And because cancer doesn't also come with a pause button on the rest of life, it's often the case that in addition to your cancer journey or experience, you may be experiencing other life changes like finishing up school, starting or ending a relationship, moving. All of these life changes can also have an impact on your finances. So it's certainly no surprise that so many cancer survivors have questions about finances, and hopefully today I'll be able to give you some answers. But before we move on to the practical tips of how to rebuild financial security, we want to start off with how do we figure out where people are right now. And the first step is to take stock of your current financial situation. And this can be done in a lot of different ways. I am partial to spreadsheets. I find them to be a really great tool for keeping track of a lot of information. And the great thing now, it used to be that you have to have really expensive software on computers, but now spreadsheet software is available for free through sites like Google. And this is an example of what we call our financial big picture document. And it's a template for people to be able to collect information about all of their assets, which are going to be things like property, cars, a wedding ring, any savings or checking accounts, any retirement account somebody might have, emergency funds. Those are all going to be assets. And then it's also a place to list liabilities. So car loans, student loans, mortgages, credit cards, anything that you owe money for can also be listed in this document. And you can download this financial big picture on our website. I've provided the address here, and customize it to your needs. So we've put in some examples just to get you thinking, but you can delete everything that's in there and input information that's relevant to you. We've also put in placeholders for you to add additional information like contacts or notes. And again, it can be really useful to have all of this information in one place, especially if you get to a point where you need your financial power of attorney to take over some of these financial matters for you. They don't have to try to hunt down the account number for your mortgage company to try to pay it. And once you kind of collected all of this information, and I look at this as the dollars and cents, there's some other big picture questions that we recommend people start with. Because even if you've had a financial plan prior to your cancer diagnosis, we often hear that people really need to stop and take note of where they are post-treatment or mid-treatment, depending on where you are. And then figuring out what your financial picture looks like can help you decide which of the steps I'm going to talk about today you need to take, if any. It can also help you identify priorities. Maybe your first priority is you need to find a job. Maybe you're nowhere near that stage because what you need to do is prioritize opening that stack of bills you've been too scared to open. Maybe you're in a place where you're through the deepest part of it and you're ready to start thinking about building your savings or contributing to a retirement plan. So figuring out the next steps are going to be very personal to each of your situations. But to get a clear picture, we suggest you kind of start with these questions. So what's the current status of your finances? Were you able to keep working or did you need to take time off? And how did that affect your situation? If you're finished with treatment, are you back at work? Were you able to go back to the same type of work and therefore the same kind of pay? Or because of side effects, did you need to look for another career path? And did that have an impact on the pay that you're bringing home? Do you have a predictable income? What are your reoccurring and potential expenses? And we'll talk a little bit more about that when we get to budget. And this goes back to the financial big picture document, but if you haven't completed that, ask yourself what assets do you have and what secured and unsecured debt do you have? Secured debt is going to include things that are secured by an item, are going to include loans that are secured by an item. So a car loan is secured by the car. If you stop paying on that loan, the car gets taken away. Unsecured debt, on the other hand, there's certainly consequences for not paying back that unsecured debt, but you're not going to necessarily lose a particular item. So we're talking about things like student loans or personal loans, credit cards are all unsecured debt. Now, once you have a sense of the answers to these questions, you can then move on to some concrete steps that you can take to improve your financial health. And generally speaking, I think the first step for most people is going to be checking your credit. People are often surprised to learn that your credit may be checked when you rent an apartment, lease or buy a car, buy a home, or even get cable television. Additionally, some potential employers may conduct background checks that include looking at your credit score or your full report. So it's really vital to know what's in your credit report so that if it comes up, you are prepared. Now, fortunately, of all the things we're going to talk about today, I think this is the easiest step to take. Each of the three national credit bureaus, Equifax, Experian, and TransUnion, are required to provide you with a free copy of your credit report once every 12 months, but you have to ask for it. So you can go to annualcreditreport.com or call the number that I've provided and ask for your credit report. Once you receive it, it's really helpful to check to make sure that all the information included is correct. If it's not, you can request that the credit bureaus fix the information. Now, credit bureaus are allowed to report negative information for 7 years and bankruptcy information for 10 years. So negative information might be something like you missed a payment, or you participated in a debt solution that, let's say you owed $10,000 on a credit card and you made an agreement with the credit card company that you would pay a lump sum of $5,000, close the credit card, and your debt would be eliminated. Well, that's a debt solution, and that can be reported negatively for 7 years. Now, that can seem like a really long time, but you may be able to use the timing to your advantage. For example, let's say you're trying to buy a car and you need a car loan. 6.5 years ago, you negotiated a settlement to close that credit card for less than you actually owed, and that's going to show up negatively in your credit report and will lower your credit score. Because you have a lower credit score, you're probably not going to get the best interest rate on the loan. But remember, it can only be reported for 7 years. So if you are in the position where you can wait 6 more months to get that car loan, then that item will no longer be on your report and you may be able to get a better deal. Now, I certainly understand that life doesn't always work that way and you may need the car immediately, but I bring it up because when you do have some flexibility, understanding how this works can be very financially beneficial. Now, once you've assessed your financial picture, including checking your credit, the next step is creating a budget. And this is one of those things where it just sounds so easy, create a budget. But when you actually sit down to do it, it can be really challenging. Your budget should include any new information that you've gleaned through this reassessment, including any additional expenses that you might have related to future medical care. And it can be hard to project expenses, but there are some ways to do it. So you could look back at old bills to get an idea of how much future care would cost. So, for example, if you know that part of your follow-up care is going to be an MRI every 6 months, and you've had MRIs in the past, you can look to see how much those cost and project forward. Again, it's not a perfect system, and it takes a little bit of legwork, but a little bit of work now might be able to set you up for a better financial future. In addition to when you're creating this budget, you want to include all of the income that you're getting. And it's not just the wages that you get from your primary job, but any other sources of income. So do you have interest on an account? Do you receive child support or alimony? Any income that comes in should be included. And then, of course, all of your expenses. It is very important when you are creating a budget to be realistic. I frequently tell a story about a woman who heard me speak, came back a year later, said, I created a budget and it just didn't work. And so we kind of started to peel back the layers, and what we realized was she was only budgeting $100 a month for groceries for her family of 4, which most of us can't really survive on $100 a month for 4 people for food. And when I asked her why she did that, she said, well, if she didn't do it that way, then her budget was always going to be in the red. And so we really had to step back and have a long conversation about the point of a budget and how we had to be realistic. Otherwise, it's an exercise in futility. If you want to create a budget on your own, remember that you don't have to reinvent the wheel. There are literally thousands of free templates available online that you can download and customize. And then there are some software options like Quicken or even some smartphone apps that are pretty inexpensive that can help you through the process of creating a budget. But you may still be uncomfortable or overwhelmed with the idea of doing a budget completely on your own, and that's totally fine because, again, we recognize that it's not as easy as it sounds. And you might feel like this couple who's sitting at their kitchen table discussing their finances, saying, well, we can pay off our past and save for our future as long as we avoid the present. So if you have similar sentiments, the best option for you may be a financial planner. And financial planners work with people of all income levels, so don't feel like you have to have millions of dollars to utilize one. You can visit the Financial Planning Association to find a financial planner in your area, and many planners will provide an initial consultation for free with no commitment. You may also want to consider contacting a consumer credit counseling agency, which can provide you with practical tools like financial calculators or budget worksheets. They may also be able to help you negotiate some payment plans or settlements with your creditors. So they're a really wonderful resource for people who may have a lot of debt. But just remember that those debt solutions that they may negotiate could negatively impact your credit score. Now, this is one of those personal decisions again. Maybe you know that you don't need credit anytime soon because you already have a mortgage and a brand new car. So for you, it may be a smarter decision financially to reduce your debt and absorb that 7 to 10 year hit on your credit to reduce your debt now and pay less in the long run. But again, it's so personal that I really think talking with a professional can be a great idea because it can be challenging to figure out where you're going to be in 7 years. And that leads me to this idea of rebuilding your credit. Sometimes people approach us and feel like because their financial picture is dim at the moment that they'll never be able to rebound. And certainly it can be challenging to raise your credit score once it drops, but it's not impossible. And just because you have a low credit score doesn't mean you can't get credit. Each creditor sets their own standards and may only look at recent credit history. Some will look at the type of debt you have and recognize if most of it is medical and that you've been, a wonderful consumer up until then and make decisions based on that. So it may be worthwhile to contact potential creditors and informally discuss their standards. Now, how do you actually rebuild a better credit report? If you have more than one credit card, make sure that you're paying the balances, at least the minimum, on time every time. And if you have more than one card, try to keep those balances at less than 30% of the card's limit. So if your card has a $10,000 limit, you don't want to carry a balance of more than $3,000. Also, some people suggest paying down the bills with the highest interest rates first, filing taxes. Even if you can't pay the whole amount that you are supposed to, file your return and then work out a payment plan with your state tax entity or the IRS. It shows fiscal responsibility. Start building your savings. So even if it's a small amount every month, try to contribute to that savings account. And it may sound challenging and counterintuitive when you're trying to pay off bills. But remember, if you don't have any cash reserves and you're faced with another emergency, maybe it's an unexpected scan, or maybe it's an exploding water heater, you're going to end up deeper in debt. So having some cash reserves can be critical. And then finally, For some, retirement can seem far off in the future, but building those assets is very important, especially if you had to dip into your retirement plan while you were in treatment to pay the bills. So I recognize that this can feel like a lot to do with the same amount of money, but even if you can just do a few of these things, you show creditors some fiscal responsibility, and you are taking the right steps to rebuilding your financial health. Now, staying on the topic of credit cards for just one more moment, I think it's really important that we recognize the benefits of credit cards if they're used correctly. Using them correctly can mean a couple of different things. So first of all, I think it's important to pick the right card for you. So there are so many credit cards out there that are providing rewards and benefits. But if you pick, let's say, a miles reward card and you don't ever travel anywhere, you're not really getting the benefit of that card. Also, sometimes with reward cards, you can choose gift cards instead of merchandise, and you can use those gift cards, let's say an Amazon card or a Target card, to buy your monthly necessities. And so that's an additional way to access funds, even if you don't have a cashback card. Some credit cards even let you use your points towards paying down the balance. And these things aren't always advertised by the card, so you may have to dig a little bit deeper. Also, some cards have specific spending categories where you get higher rewards, so pay attention to those. Sometimes using a zero balance transfer can be really helpful, but we only recommend it if you know you're going to be able to pay off that balance that you've transferred within the time period allotted. And then certainly, if possible, you want to get a card with no annual fee because, again, that's money on the table for you. So narrowing in a little bit on medical bills, one of the biggest financial challenges certainly are the astronomical medical bills that can come with cancer treatment. And I think that this is an area where humor can only help. Here we have two gentlemen sitting on a bench, one saying to the other, "My doctor told me to avoid any unnecessary stress, so I didn't open his bill." And I don't really recommend this coping technique, but there are some things that you can do to mitigate the negative impact of medical bills. And as I alluded to earlier, one of the most important things that you can do is purchasing adequate health insurance. Certainly the Patient Protection and Affordable Care Act, or Obamacare, has made it easier for people to purchase adequate insurance. But that doesn't solve all of our problems, and I'm sure you've likely heard some discussion around changes to the ACA. So for more information about what's going on with the ACA, what options are out there, how to pick a health insurance plan, you can visit our website at triagecancer.org/health insurance. And we even have a new video explaining health insurance basics. If you are one of those many Americans that just can't figure out health insurance, you're certainly not alone, but there are resources there. Now, regardless of what happens with the ACA, there are some things that you can do to lower the cost of your bills before you receive care. And I recognize that many of you on the call are post-treatment, but I think it's important to share these tips with you anyway because they might be relevant for any follow-up care you may receive or any future medical care in general. And with many things that we talk about at Triage Cancer, communication is key. It can feel awkward to discuss money with your healthcare team when you're also discussing healthcare, but it is absolutely appropriate for you to ask what the treatment is going to cost. How long is it going to last? Are there any programs that can help with that cost? Many hospitals have ability to pay programs and discounts or financial assistance. Some may even waive a portion of the bill, but you're probably not going to be able to access these programs unless you talk about it. Healthcare professionals are not mind readers. They don't know that you're concerned about the cost, so you have to be proactive. Another option may be to ask your health insurance company if they have case managers that can help you through the medical billing process. They can be a fantastic resource and really helpful for you to know that every time you call the health insurance company, you're going to be talking to the same person. But I do caution people to just keep in mind, if these case managers do still work for the health insurance company and not for you. So wonderful resource as long as you keep that in mind. You can also negotiate your hospital bill. So most hospitals and providers have a billing department, and many even have patient navigators that can help you through this negotiation process. Now, when it comes to lab work, not all labs charge the same amount. So you could get a list of tests that may be performed and actually shop around for lower prices. It may also be helpful, especially if you have a high copayment, to try to group your appointments together so that you're only paying one copayment and one office visit fee. Now, it may not be possible to do this. There may be medical reasons why you need to separate various appointments, but that it may not be. So sometimes things just get put on the calendar because that's what the next available opening is, and not necessarily because that's what needs to happen medically. And then there may also be times when you can take a generic drug instead of a name brand drug, which may be less expensive. But of course, I hope that this is not a purely financial decision, and before you've taken this step, you've adequately discussed taking a generic medication with your healthcare team. Now, once you've received care, you have the potential to get several pieces of communication. Just from your health insurance company, you could get 3 different pieces of mail. One saying we've received a claim, one saying that we're processing your claim, and one called an explanation of benefits. Now, you can usually tell that it's the explanation of benefits or the EOB because somewhere in large black letters it'll say this is not a bill. But I would say this EOB is one of the most important pieces of correspondence for you to pay attention to because it will give you an idea of how much you're going to have to pay out of pocket. It'll also show you what you've been billed for, the amount that you've been billed for, your coinsurance amount. Different EOBs present this information differently. This is just an example. Really good EOBs will also indicate how much you've paid towards your deductible for the year. They could also say how much you've paid towards your out-of-pocket maximum for the year. And then if you have a family plan, it may also say how much your family has paid towards the out-of-pocket maximum. So there's a wealth of information on these EOBs. They can be a little challenging to decipher sometimes. So on the previous slide, I did provide you with a couple websites for tips on how to read the EOBs. But I also think that it's important for people to know that they absolutely have the right to contact their provider and or the health insurance company to get an explanation of what is on their EOB. Now, the last piece of information that you're likely going to receive is going to be from your provider directly. This could be from the hospital where you get care. It could be the doctor's office or the lab company. The amount here is generally the amount that you're going to be responsible for. But keep in mind that the communications don't always arrive in the order that I've just laid out. Sometimes you get the bill from your provider before you've gotten the EOB from your health insurance company, because it could just be that the hospital was faster at billing than the insurance company was at processing their claims. I don't recommend that you pay a bill before you get the EOB, because once that happens, it can be challenging to get money back from the provider if it turns out that the health insurance company was going to cover more than they thought it would. If you have a bill from a provider that is coming close to its due date, but you're still waiting on an EOB, I recommend you just call the provider's billing number and then let them know, hey, I'm still waiting for an EOB. I recognize that the due date's coming up. Can you either push back the due date or make a note in my file? Most of the time, providers will send out several bills before they send it to collections, but it's always good to communicate with the provider so they know what's going on. And then I also think that you shouldn't always take the bill at face value. We strongly recommend that you review your medical bills. medical bills may keep arriving long after treatment is over, and it's important to stay diligent and make sure that bills are accurate. Don't be afraid to ask the providers to clarify the codes. And if you have a lot of medical bills, you may want to consider talking with a professional bill reviewer or a medical claims organization. One example is MedClaims Liaison. But we hear all the time about mistakes in coding. It could be that you received one MRI, but accidentally it was put in as 10 MRIs and you were charged for that. So humans do the billing and humans make mistakes. So although I realize it's a large onus to put on you as the patient or the caregiver, it is important for you to check these medical bills. And then if you feel like there has been a mistake, you are entitled to dispute the bill. And if you believe that a procedure or treatment should have been covered by health insurance companies and it wasn't, recognize that you have the right to appeal that decision. Insurance companies have what's called an internal appeals process, so you would appeal to the insurance company specifically. But thanks to the ACA, all states are also required to have an external appeals process. This is sometimes referred to as an independent medical review. And usually you go through your state health insurance agency to file one of these external appeals. And on the Triage Cancer website, under our State Resources tab, we have the contact information for each state's health insurance agency. So you can go there for more information. If you're looking to file an internal appeal, it's important to contact your specific insurance company because each company has different policies with respect to their appeals processes. Typically, you have to go through the internal appeals process first before you can go to the external appeals process, but not always. Again, I'm asking you to do something extra, and I recognize that, but there's a distinct benefit to you for appealing claim denials. Estimates are somewhere around 40 to 60% of appeals are won by the patient. So it really is in your best interest to file an appeal if you think that something should have been covered and wasn't. Now, I mentioned a professional bill reviewer, and they may be helpful for some people. But all of us should really try to create an organizational system for our medical bills. And the image here on the bottom right is an example of what not to do. The piles, the shoebox method, the don't breathe or it's all going to go flying method is not really very effective. Now, there are some organizational systems that exist already, but really you can use any system that makes sense for you. Some people scan all their paper bills and keep everything on a computer or a smartphone. Some people use file folders. Some people use 3-ring notebooks. I've seen it all. And I think really the important thing is to pick a system that you can stick with or else it's not helpful. It's also, I just wanted to mention that Triage Cancer has a webinar archived on our website presented by a professional organizer about dealing with all the paper. And some of the resources that she talks about are listed here. And some of them are paid services and some of them are free, but they can help people deal with medical information and personal document storage. Now, when we're talking about organizing, it's not just about the bills, but it's really useful to keep track of all of the expenses that you paid out towards your medical care, any pre-authorizations you've received from a health insurance provider, any EOBs, anything that's non-reimbursed, meals, lodging, parking at your hospital. And the reason that we specifically say to keep track of some of these expenses that aren't covered is because some of them may be tax deductible. So keep the information and then make sure to mention them to your tax preparer if you have some of these expenses. Now, if you are in a situation where there are people that you owe money to, otherwise known as creditors, try talking with them. The best time to do that or to have that conversation is before the unpaid bills get sent to collection agencies, which can help protect your credit. So when you are talking with these creditors, there are a couple of things that you can ask for. Certainly, you can ask for more time to make a payment. You can check to see if they would be willing to negotiate a payment plan or accept a lower lump sum payment. And some may be willing to write off a portion of your bill. And this strategy works with pretty much any type of creditor. It could be your landlord, your student loan company, certainly your healthcare providers. We hear all the time about healthcare providers and hospital systems that are willing to work with patients to come up with payment plans. The motto here is really, it can't hurt to try. If they come back and say no, then you're in no different of a position than you were in. Just a reminder here, if you're considering paying medical bills by credit cards, be very careful about that because most credit cards have a very high interest rate and you, in the long run, will end up spending much more money than is necessary. It's also not recommended that you take a loan out on your home, like a second mortgage or a home equity line of credit to pay your medical bills. Because when you do that, you essentially turn unsecured debt into secured debt, and you risk losing your home if you can't make those payments. As consumers, we have rights. And I recognize that this cartoon is a slight exaggeration, but it can sometimes feel like this for people who are struggling to pay bills. And for those of you who are just on the phone, there's a man reading a letter that says, "If you've already sent us your payment, please accept our apology for the death threat and warm wishes for the holiday season." But thanks to several legal reforms over the years, debtors have more rights when it comes to the behaviors of collection agencies. One of these protections is restricting when they can contact someone in order to collect a debt. For example, you can only be called between 8 a.m. and 9 p.m. There are also restrictions on who they can contact and how many times they can contact you. So it's important to know that even though you may owe money to someone, that you still have some rights. Debt collectors are not allowed to threaten or harass you. They can't contact you if you've already asked them to stop contacting you by written letter. They can't contact you at work if you tell them that your employer doesn't approve of it. They also can't garnish or take away federal benefits like Social Security benefits or supplemental security income or veterans benefits. Now, if you feel like a debt collector is acting inappropriately, your recourse is to contact the Federal Trade Commission, or the FTC, and their website is just ftc.gov/credit. Now, if you don't pay your bills, certainly there are consequences. You may not be able to continue receiving care from that doctor or hospital. You may have your wages garnished, which means that they take money directly from your paycheck. Now, remember we talked about if you've stopped paying on debt that's secured by an item, like a car or a home, you could have that item taken away. And then finally, you may have to declare bankruptcy so that your debtors can get what is owed to them. If you have already worked with a credit counseling agency and you're still unable to pay or negotiate a payment plan for your bills, bankruptcy may be appropriate. However, bankruptcy is not really something that experts recommend you do DIY or try to do by yourself. You may want to consider talking with a bankruptcy attorney because there really are very wide-reaching consequences. You can find reputable attorneys at lawhelp.org or your state or county bar association. There are some tools like LegalZoom. With LegalZoom, you can answer some questions about your situation, and for a fee, you'll be matched with an attorney that can assist you. And this could be a good option for people who don't have complicated financial situations. But whichever way you go about finding professional help, it's really critical to become informed about the bankruptcy process and its impact on your credit report. An individual can file bankruptcy under Chapter 7, which is sometimes referred to as fresh start or liquidation bankruptcy. But it's becoming increasingly more challenging to completely eliminate medical debt through bankruptcy than it has in the past. Also, remember that bankruptcy is, in fact, not free. So on average, it could be about $2,500 for a very simple estate, and it could take 4 to 6 months. So bankruptcy is not a quick fix at all. Again, more information on our website. We have a quick guide to bankruptcy. Now, the reality is, even if you've done everything I've talked about, there sometimes just isn't enough money to go around. And that is where financial assistance comes into play. And there are different types of financial assistance or income options that might be available to you. There are different types of insurance coverage that you may already have through your employer or that you've purchased on your own that can provide this financial assistance. And one of the most important is disability insurance. Disability insurance is insurance that provides employees with some income when they're unable to work due to a medical condition. There are private, employer, state, and federal disability insurance plans. Now, keep in mind that each type of disability insurance has a different definition of disability. And even if you've completed active treatment, you may still be experiencing side effects from treatment or have other medical conditions that keep you from going back to work. With the private disability insurance plans, they really are very specific to the policy itself, so critical to ask your employer or the insurance company for details on the policy. Now, there are 6 states and territories that have short-term state disability insurance programs, and I've listed them here. And again, the details really vary by program. And then finally, there are 2 federal long-term disability programs, Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. Both of these programs are administered by the Social Security Administration, and you can get more information at triagecancer.org or by going to the Social Security Administration's website at ssa.gov. Now, I know there are some caregivers on the call, so I just wanted to mention that there are some pretty limited but still available income options for caregivers. Some states have paid leave for caregivers, and then some states, through the state Medicaid program, allow caregivers to receive some funding for providing in-home support services. Now, this program is called something different in each state. So, for example, in California, it's called in-home support services. In Illinois, it's the home services program. So it's a little different in every state, but you can get more information about those programs on our website. Now, some other sources of income could come from kind of some out-of-the-box thinking. So do you have a disability or supplemental health care program through your employer? Some of these plans will pay for certain benefits and provide additional sources of income. But also, you might have some policies that you can use as collateral for a loan to access quick cash, like a 401k plan or a life insurance policy. Policies, maybe sometimes a cancer policy could be an option. Maybe it's about adjusting your tax deductions so that you're receiving more cash up front throughout the year and you would get less in a refund later. If you already have a life insurance policy, ask about, if your policy contains a waiver that allows you to stop paying the premiums when you're unable to work. Maybe a viatical settlement is the right thing for you, and that's where you sell your life insurance policy to a third party, typically less for the full amount. And they've gotten a bad rap over the years, but they could be a really useful option for some because you get access to cash now. And if you don't have any beneficiaries that you think would need the money should you pass away, this could be a great way to kind of cash in from a policy that you've had. So some out-of-the-box thinking ideas there, but could be really useful for some people. And we're getting close to the end of the hour, so I just wanted to mention another resource called cancerfinances.org. And on this website, you are asked to answer some pretty basic questions, and it will lead you to tailored information about health insurance, disability insurance, and then financial assistance options. And some of the financial assistance options that are included are going to be programs through local, state, county, or community organizations. Certainly, we have listed many of the cancer organization programs that are out there, like the SAM Fund that provides financial assistance to young adults, or LLS, or American Cancer Society. I've just put a few on the side here. There are some private programs like Patient Services Inc. that might provide some financial assistance. And then fundraising, personal fundraising has become much more popular recently. Two sites that are out there are GoFundMe or Give Forward. And these are typically sites where loved ones will set up a fundraiser for someone who's going through treatment, and people can donate to them. They are a wonderful way to get loved ones near and far involved in what's going on. But I also just kind of have a little asterisk when we talk about fundraising, because it's important for people to recognize that some individuals may not be publicly disclosing their cancer diagnosis, or they may be talking about it in their private world but not talking about it at work. And once a fundraiser is created, generally that's going to be searchable online. So when someone Googles that person's name, that might be the first thing that comes up, and then their whole story is told. So before we recommend that really you think through the disclosure discussion that Triage Cancer and Cancer Careers has quite frequently before signing off on a fundraiser, and then also thinking about the other ramifications. So sometimes money raised through these fundraisers could actually impact other benefits that somebody is receiving, like Medicaid or Social Security disability insurance, because it would increase their income. So, SSI, because it would increase their income. So again, these fundraisers, I think, are a really wonderful idea for a lot of people. It's a great way to get people around the world involved, but we just want people to think through all of the ramifications before they jump headfirst into creating one, either for themselves or for a loved one. There are also some financial assistance programs specifically geared towards paying for treatment. There are some copay assistance programs, and then there are prescription drug assistance programs. Almost every pharmaceutical company has a drug assistance program. The rules and the application process differs tremendously from company to company, but if someone is having a hard time paying for their prescription drugs, it can be a really useful resource. Now, we hear sometimes that someone will say to me, well, I can't pay for my prescription drugs, and I don't qualify for the prescription drug assistance program, but I have money for all my other bills. And it happens a lot where we get a little bit of tunnel vision. And so what we urge people to do is sort of step back and look at this as a big picture. So you may have money for all of your other bills, but not your prescription drug. well, maybe you could do something like apply to a utility assistance program and get your gas bill covered. And then the money you had set aside for your gas bill could go towards your prescription drugs. And so we urge people not to get that tunnel vision and to really look at this as a big picture situation and to try to access as many different programs as possible. There may also be programs available to help pay for transportation to and from treatment, lodging expenses, parking, even sometimes gas programs. And then if somebody is having trouble paying for their higher education, there are some higher education assistance programs. We've even seen scholarship programs that are specific to cancer survivors pop up. And then there are some options about dealing with student loans due to a disability. And I will just put a little asterisk on this slide to say stay tuned, because we are hoping to release a module on cancerfinances.org very soon with some more resources around education. So that's just a brief overview of the different types of financial assistance options that are out there. And for more information and specific examples and contact information, I recommend going to cancerfinances.org. So with that, I'll turn it back over to Nicole.
Thank you so much, Monica. That was such a great explanation of some of the important considerations we all need when managing your finances during cancer. I just want to bring everyone's attention to this slide really quickly. Cancer and Careers and Triage both offer various resources to address the challenges that come with balancing work and a cancer diagnosis. Cancer and Careers also offers free publications available for order or download on our website, including our Living and Working with Cancer workbook, which includes worksheets for helping you manage health insurance claims, as well as doctor's appointments and medical history, as Monica had mentioned being so important. Our website also has a number of articles on managing finances, as well as a directory of financial work, legal, and support resources. And here are several of our upcoming webinars, including a few new sessions that we're excited to introduce. Also, throughout the year, we host many free events, both in person and online, which explore a variety of topics related to work and cancer. So for more information on events, check out our website, cancerandcareers.org. I also want to just point out that we have travel scholarships available to our conferences, so if you visit our website, you can learn more about that as well. And also, additionally, we've included a number of resources beyond our organizations that may be helpful if you're looking for more information on some of the topics that were discussed today. Now it's time to open up the call for questions. So our operator, Kat, will explain how the Q&A works. Kat?
Yep, thank you so much. The floor is now open for questions. If you do have a question, please press *1 on your telephone keypad at this time. If your question has been answered, you can remove yourself from the queue by pressing 1. Again, ladies and gentlemen, it is *1 on your telephone. You may also type in the Q&A on the web.
Kat, is there anyone on the phone?
Not yet. Oh, there's one person, and our first question comes from Sylvia. Sylvia, go ahead.
I apologize. I pressed the wrong key. I apologize.
Okay.
I did have a question, but it left my mind now. I apologize.
You could ask your question.
Okay, and you said something about finance, because it was kind of low. I was trying to hear the last statement that was stated.
What statement was that?
That's what I'm saying. My phone was low, where I couldn't hear the last statement that was stated about finance.
Regarding educational resources?
Yes, ma'am. Yes, ma'am. The educational resource.
So I was just saying that we are going to be uploading some additional educational resources on the website cancerfinances.org. So for more information than what's just on this slide, stay tuned.
Okay, that's what I wanted to. That's what I missed. Thank you so much.
No problem.
Again, ladies and gentlemen, it's *1 if you'd like to ask a question.
It looks like we have one in the chat box. It's questions from Amanda. For SSI, does the spouse's income count also?
That's a very good question. I have to think about that for a second. And I would want to know, it does count. Sorry, I had to think that through for a second. It is going to count, and so for more questions about specific income eligibilities for SSI, I would definitely recommend contacting your local Social Security Administration office, and they will set you up with a case manager and go over the specifics with you.
Kat, no one on the phone?
No questions as of yet. Again, it's *1.
All right. Well, I don't see any further ones in the chat box, so I think we can wrap it up. We're at the top of the hour anyways. Thanks again, Monica. This was extremely informative, and unfortunately it is impossible to cover this topic in only an hour. So if anyone comes up with any questions following this webinar, we'd be happy to answer them if you want to email them to cancerandcareers@cew.org. And also, as I mentioned, you will receive an email that links to the evaluation Thursday afternoon before 5 p.m. We'd appreciate you taking the time to fill this out so that we can best develop the program to meet your needs and so that we can continue to receive the funding to offer these kinds of programs. For those of you requesting CE credit, instructions for doing so will be included as well, and I've put them up on here also. Thank you all for attending today, and have a great afternoon.